It is 7:09. Good morning, and thank you for starting your day with us here at 94.3 The Point. Liz and I were talking yesterday about Angelina Jolie's announcement and how it really will serve to start a dialogue with so many women around the country and around the world. And joining us this morning, Dr. Deborah Camal, Medical Director of Meridian Cancer Care, to talk a little bit about that. Doctor, great to talk to you. Welcome to the show.
Thank you so much for having me.
Hi, how are you?
Hi, Liz. How are you?
Good.
So let's get the conversation started. What do women need to know?
Well, the fact that Angelina Jolie came out, in public and made this announcement, I think, just as you said, it starts a dialogue. Women need to know that there is a test out there where you can actually help assess your personal risk for getting breast cancer. And this genetic testing doesn't apply to everyone. Not everyone needs it. But if you talk to your physician, if it's determined that, your risk is high enough to warrant testing, finding out the results of this blood test can help you assess your personal risk, which can help you figure out what options are available to help preventing you from getting breast cancer. So I just simply by going public with that, the women will be more aware. Hopefully they'll be a bit less afraid of some of the preventive options available.
So what are some of the factors that might make a woman need this test more quickly?
Well, one of the things we often consider is family history, and there's a lot of misinformation about family history. For example, women inherit half of their genetic material from their father's side of the family. So if you have two aunts and a paternal grandmother that had breast or ovarian cancer, that could put you as high a risk for a mutation as getting that information from your mother's side. So getting a full family history, finding out what types of cancer in the family can help you figure out whether the risk is high enough to warrant consideration for genetic testing. Also, if women are young when they're diagnosed with breast cancer, and, young varies depending on how old you are, obviously, but, roughly under 50 or even certain biologic types of breast cancer give women a higher risk for carrying a mutation. So many physicians know this information. They can help advise their patients. And most importantly, we have well-trained genetic counselors who can sit with women and explain to them what their risks are. And one thing that was not quite an Angelina Jolie's press release is that insurance usually pays for genetic testing if the risk is high enough. I mean, if you have very low risk and you just want to be genetically tested, insurance probably won't pay for that. But if your risk is high enough, most insurance companies will cover it.
Now, we have spoken with you year after year, Breast Cancer Awareness Month, and, of course, Paint the Town Pink campaign that's going on. Do you still find that there are a lot of people who are just really afraid to get this all started?
Absolutely. There's a fear. Fear takes so many forms, and I have women afraid to even walk in and have a mammogram because it's painful, or more importantly, they're afraid of what the findings might be and how that's going to change their lives. But early detection really does still count for something. And although there's lots of talk lately about tumor biology and the more aggressive tumors taking a certain course as opposed to the less aggressive tumors, the earlier you find a cancer, the easier it is to treat, the less a person potentially has to go through, and potentially the less risk there is to their life down the road. So getting rid of that fear and just simply, showing up for testing, talking to your doctor about it, mentioning a lump when you have one, that just, it's not, the problem's not going to go away if you don't talk about it or acknowledge it. So by Angelina Jolie coming out and talking about this, I think more women will say, well, my mother also died of cancer, and maybe now I'm not quite as afraid to go and pursue this or to get breast testing or whatever it is that I need.
Yeah, you're right about that. The not knowing doesn't help anybody. It's almost like a state of denial because it could be scary to go for a test and then wait for a result.
Right, and once you're in denial, I see this over and over again. A woman will feel a lump, she'll, kind of push it aside, and then every day you obsess, you worry, so you're not making your life easier by not getting it addressed. It takes over, and then, denial can last for years, and then suddenly you have a very far gone problem that's far harder to treat. So, I think we have good pain control methods, reconstructive surgery is better and better, so, the fear should be, at least addressed, and if women get information, that will often address the fear that they're having.
We're talking with Dr. Deborah Camal, the medical director of Meridian Cancer Care. If women want more information, or if anybody wants more information, of course, what's the best way for them to get this whole thing started?
Well, the first thing they should do is probably talk to their doctors, and for most women, that's either a gynecologist or a primary care physician. If they don't have a solid relationship with a doctor, they can always just come to, for example, one of the Meridian facilities and just go to the Women's Center and say, it's been years since I've had a mammogram. I think I need one or want one, and then the staff there can help them obtain a prescription if necessary or insurance approval. There are even programs available at most of the hospitals for women who are uninsured or underinsured to get mammograms at low cost. So either physician or any one of the health facilities can help start that process.
Dr. Deborah Camal, always great to talk to you. Thanks so much for all the info.
Thank you for having me.
All right, there you go. It's 714-94-3, The Point.